We like to think that healthcare in Canada is free, but that's not always the case. In fact, right now, some cancer patients are paying thousands of dollars for treatment. The reason? Their particular treatment comes in pill form and is taken at home instead of at the hospital. As Sophie Louis found out, some patients are on the brink of going bankrupt, even selling their homes, just to cover the cost of their cancer.
She was such a loving, caring person. We went through probably heaven and hell like everybody else, but we managed to the love was there and it just kept going. 40 years of knowing her. If I had my way, it'd be another 40 years. But I didn't really know she was sick. All of a sudden, she said she was going to the doctors for whatever reason, and then they were doing tests on her. It was hit like a ton of bricks. You've got cancer. It's like total shock for everybody. It's like someone cut off your head. I was lost. I didn't know what to do.
Judy Pope, Gary's wife of almost 40 years, was diagnosed with kidney cancer, a diagnosis that would give her about a year to live. 54 years old and fiercely determined to fight the disease, Judy found out her type of cancer wouldn't be treated with radiation or intravenous chemotherapy. Instead, her only option was Nexivar, an oral drug that targets cancer cells.
There was a pill on the market, and it could help her. It was a very expensive drug.
The expense was huge. The drug was going to cost more than $3,000 a month. Luckily, Gary's insurance would cover it.
We were an average people, right? I didn't even make that kind of money. But the company I worked for, thank God, covered it. The insurance covered it.
The drug and the insurance that paid for it kept Judy alive for years, far longer than the year the doctors expected her to live. But in 2009, Gary's employer changed insurance companies. Under the new plan, Judy's pill wasn't covered. Gary was now on the hook for $3,200 a month for his wife's life-saving drug, a giant price tag he never thought he'd have to pay here in Canada.
Oh, I was so angry. I don't even know how I survived, being honest. I thought to myself, we're in Canada. We paid into the system all our lives. We're supposed to have this kind of thing when we need it, right? The coverage and stuff, you know, the help.
They're saving people's lives, and that is really what medicine is all about.
Dr. James Gowing is a medical oncologist. He's been practicing for 49 years. He started back when cancer was diagnosed with x-rays and slides, and treatment was rudimentary.
We have used drugs in the past that were probably worse than the disease.
He's seen advances since those days, but nothing quite like this.
This was the first, I guess, miracle that I saw in my years in oncology.
The miracle he's talking about are pills that fight cancer.
They take one pill a day, and in a week their counts are normal. And as long as they keep taking that pill, they can live a natural life, more or less, with very few side effects.
But a lot of patients are struggling to take that pill. That's because Canada's healthcare system pays for hospital care, but not all prescription drugs that patients take at home. Dr. Gowing says he knows of people with cancer who ration out their dosage or are on the verge of bankruptcy trying to pay for their pills.
What that would do is make us even worse off than the United States, where the #1 reason for bankruptcy in the United States is medical costs. That can happen here in Canada and has happened in some regions.
Even worse, Dr. Gowing says some doctors are shying away from prescribing these pills to patients who may not have the means.
I think in a lot of situations, doctors don't want to tell the patient about treatments that they can't get for them, particularly if they know that they can't afford them.
The problem is these pills can cost tens of thousands of dollars to take. And although they are becoming the new standard in cancer treatment, most Canadians don't have that kind of cash to spend.
It's not fair to say that we'll give you the coverage if it's in the hospital, but we won't if it's in the community.
Steve Morgan is a leading authority in pharmaceutical policy. He says drug coverage in Canada is very uneven. Some provinces will fund these oral drugs, while others won't.
Prescription drugs, it's what some people refer to as a dog's breakfast. It's all kinds of different policies in every province.
The divide seems to be at the Manitoba-Ontario border. If you live west of Ontario, you're very likely to get easy access to these drugs. But by the time you get to the Maritimes, it's really pretty desperate for people.
There are a few options for patients. Some provinces have reimbursement programs to cover expensive drugs. But Dr. Gowing says the amount of red tape to apply for these programs makes it nearly impossible for patients to get funding.
What a waste of time. What a waste of oncologists' time working on this. If this is the proper treatment, and to me, it's as if the Ministry of Health or the government doesn't trust me as a physician that I would do the right thing for my patient.
I was totally shocked, surprised, because that was her lifeline, the pills, and the government would not pay for her lifeline.
Gary reached out to the Ontario government, hoping one of its programs would help, but he was turned away. Desperate, Gary wanted to sell all his assets to buy his wife more time.
Well, I tried to talk her into selling the house, at least give her, hopefully, more time. But she would not do that. She had no part of that. She thought that I worked we worked so hard all our lives to have what we have, and she just didn't want it taken away for her.
16 by 9 reached out to Ontario's Minister of Health and Long-Term Care, Eric Hoskins, to talk about oral cancer drug coverage for patients. The minister declined to do an interview and never got back to us with a statement. That leaves oncologists like Dr. Gowing wondering how they will look after their patients.
To put all this effort into caring for a patient, but not being able to treat them properly, that's devastating to the patient, but to the physician as well.
As for Judy, she stopped taking her cancer pill, believing her family would go bankrupt if she didn't. She died in hospital 6 months later.
I watched her take her last breath, and that was hard. I don't know what else to say about that.
Next, facing cancer without coverage.
I thought I would be taken care of. I thought that my government had my back. Thank you.
In the imaging department at Cowichan District Hospital in Duncan, British Columbia, Barry Harvey waits.
Waiting is what hurts, not the actual procedure.
In 2013, he was diagnosed with a gastrointestinal stromal tumor, an uncommon cancer found in the digestive system.
I was down to 114 pounds. I was looking at being sick all the time.
To shrink his tumor, doctors prescribed Barry a pill that starves cancer cells and prevents them from spreading.
Hopefully you don't find anything.
Today, he is getting a CAT scan to find out whether his cancer returned.
I'm hoping this is the last time I'm going to be here.
You may breathe normally.
I'm hoping that this is going to allow me to stop worrying about living and get on with life.
Barry is one of the lucky ones. That's because he lives in BC, one of the provinces that covers oral cancer drugs under its healthcare system. But Barry still ended up with huge bills to pay. BC doesn't fully fund the cocktail of extra medications he needs to take to manage the side effects from his cancer treatment.
I've had to pay for 21 other drugs.
Barry is one of the growing number of cancer patients who has to spend hundreds of dollars every month on medications to cope. A lot of these extra prescriptions aren't paid for by the provincial government.
I thought originally I would be taken care of. I thought that my government had my back.
At one point, Barry got so sick, he had to stop working. He was taking drugs for high blood pressure, insomnia, and extreme nausea, most of which were being paid for out of his life savings.
It made me sicker. And I couldn't trust myself to eat. Sometimes I would choke on my own nausea.
It's putting people with serious illnesses like cancer at significant financial burden.
Steve Morgan is the director for the UBC Centre for Health Services and Policy Research. He says patients can incur hundreds, if not thousands of dollars in expenses every cycle of treatment. And those extra fees are forcing some to avoid filling the prescriptions they need.
If you put a financial barrier between a patient and a necessary medicine, we know that some of those patients, they'll stop taking the drug, their disease will get worse, they'll end up in hospital.
It's put me in debt. I'm happy that I have a Visa card, but I'm not happy that I have to use it.
How much would you say you've spent since you were diagnosed?
I could probably easily say $10,000, $12,000. That's money I don't have. Money that's not in my savings anymore. There's no savings.
Barry's oral cancer drug is paid for, but he can't afford to take the other 21 medications he needs. So Barry has cut back to only 7 to save money.
This is something that should be a bit of a national embarrassment. When you allow there to be a significant financial burden on people who are taking medicines that are deemed to be cost effective, but for which they're not offered public coverage, that's problematic.
According to Morgan, Canada's universal coverage is flawed because prescription drugs are not part of its public healthcare system.
Around the world, there's no other country that would say, we're going to cover the cost of you visiting a doctor and being diagnosed with a need and being prescribed a treatment, but we're not going to cover the cost of the treatment itself.
When it comes to drug coverage, how does Canada compare to other countries around the world with similar healthcare systems?
Every single country with universal coverage for healthcare provides universal coverage for prescription drugs, except for Canada.
Morgan says in a few years, if Obamacare is fully rolled out, even the United States will surpass Canada in terms of medication coverage.
We're way behind, and soon we'll even be behind the Americans, which is nothing to be proud of.
There we go. Perfect.
Sit there for a minute, don't jump up. Okay, we don't want you to drop on your head.
When we first interviewed Barry, he was getting a CT scan to see if his cancer had come back. Now, months later, his results are in. They're clean, no signs of cancer. But he knows there's always a chance of it returning.
I've been to hell. I know what it looks like. It's been an incredibly difficult year. Physically, mentally, financially. It's been a very, very tough year.
A year that perhaps didn't have to be as tough as it was, if not for a healthcare system that forces some cancer patients to choose between their lives and financial security, a choice Barry will struggle with for the rest of his life.
I would have liked to have retired. I had planned on retiring. Unfortunately, something called cancer got in the way.
Next, getting an energy bill that was shocking.
I was kind of dumbfounded, really. How can they say they've saved me any money?